Bien, bonjour à toutes et à tous. Merci donc de venir assister à notre troisième session de case speakers. Des case speakers qui nous viennent de l'étranger et qui nous font le plaisir donc d'être parmi nous aujourd'hui. Donc nous avons le plaisir d'accueillir Madame Terje Peetso, qui est policy officer à la Commission Européenne, et Monsieur Lu Chia-Feng, qui est un avocat américain installé à Tokyo. L'objectif donc de ces deux case speakers est de parler d'un sujet assez vaste, compliqué, avec beaucoup de zones d'ombre, qui concerne donc les enjeux juridiques et réglementaires de la mobile health et de la m-santé, et donc d'essayer d'avoir un comparatif quelque part entre deux marchés différents, le marché européen et le marché asiatique, et donc de voir quels sont les défis et quelles sont les questions. Pour commencer cette session, donc, je vais demander à Madame Terje Peetso de bien vouloir me rejoindre, qui va donc nous faire un premier exposé d'une dizaine de minutes, qui sera ensuite suivi de l'exposé de Monsieur Lu pendant une dizaine de minutes également. Et ensuite, nous aurons donc un temps pour échanger avec nos invités. Dernière chose et dernière précision, ces interventions se feront en anglais. Pour ceux qui souhaitent avoir un système de traduction, il est disponible à l'entrée.
Thank you very much for the introduction. Thank you very much for inviting me to participate here in the Ehealth Summer University. And I'm very sorry that, again, also I'm here the second time. My French actually has not yet got to the level where I could give my presentation in French. So I probably see more earphones now on these sessions than this session where most of people speak French. So I have 10 minutes to give you an overview of what are we doing in the European Commission and, in other words, at the EU level as regards the m-health. First of all, I would like to start with reminding you that the major principle is that healthcare is a competence of the member states. So the rights on what the European Commission can act on in these fields are rather limited. And our major participation in this could be divided into three main actions. We collect the good practice, we share the good practice, and we fund the research. And then we have other areas where we can operate within the cross-border healthcare directive, for example, where Article 14 on e-health is dealing with the electronic health records and e-prescription, or when we speak about some other areas of work where m-health may come up as a tool. But for the regulation, we haven't foreseen really a directive or regulation that would do something specifically on m-health. So where are we? A little bit of a history. Where do we come from with this topic? In principle, there exists under the Medical Devices Directive part which regulates the software applications. And that's why the medical apps that fall under the Medical Devices Directive already have a long history of regulation of them. However, there is a huge other field of apps available, so-called health and well-being apps, where nothing has really happened until now. And it was first called to our attention by the Ehealth Task Force that gave its report in May 2012, where it was really highlighted that the need about to do something with this information that is collected through the mobile apps, health and well-being apps, that something needs to be done in that respect. This was taken up by the eHealth Action Plan 2012-2020 that describes all activities happening in the area of e-health at the EU level. And there was also mentioned this need for setting a green paper on mobile health for the purpose of understanding and perhaps taking some actions in that field. Following these two documents, the green paper on mobile health was published in summer last year. It was open for public consultation for 3 months, and everybody who was interested or felt that this field is very close to their work, or that there is something needs to be done that is particularly affecting their work or their well-being, they had a possibility to submit their comments. Overall, we received more than 200 comments from different organizations, from NGOs, from private sector, from government offices. And that all was put together into the report on this green paper, which was published in January this year. So, based on this consultation and the summary of all the comments we received, we have now taken the follow-up actions, and these are the main actions that I would like to highlight in my presentation. First of all, majority of participants in this public consultation mentioned the need to do something about data privacy and security. And that is understandable, because we know that there is a lot of discussion nowadays about the information that people have generated using the apps, and which have been stored somewhere, but nobody actually is aware of what happens with this data, how they are used, and whether anybody will make something with information that concerns me and is linked to me because it's collected by me. So this kind of clarity needs to be taken care of, and following to this public consultation, we have established now the working group that is looking into the data privacy and security aspects. It is their aim is to produce a code of conduct, and as code of conduct is a voluntary document for the industry to sign and then implement and follow, this working group is consisting primarily from the representatives of the industry. We have started the work with this group on the 26th of March. The next meeting will take place actually next Monday, and hopefully by autumn we will have a document ready that could be consulted with the widest group of stakeholders, and also that it could be then submitted to the Article 29 working group, which is established under the European Data Protection Directive, who could then give their opinion on this code of conduct. So that's the first step. The next important item that was highlighted in the public consultation was the question of quality and safety of these apps. Who is making sure that these apps that you use in your mobile phone actually deliver correct information and that they don't harm? Well, it's of course the question, how can it harm if you count your steps, for example, with an app, and you count 500 steps less? How can it harm you? That's a very simple example, and maybe that's not a good example in terms of safety, but there are also other well-being apps that could perhaps be at some point become part of your health follow-up, or the follow-up of your treatment on how you are doing, how is your sleeping pattern, for example, or how is your use of physical exercise influencing your heartbeat, etc. So all these aspects have been discussed and highlighted, and it is clear that we don't have very good overview of what is happening in this field in Europe. And that is the reason why we have also invited all interested parties to come to Brussels to organize a meeting on the quality and safety. And one of the aspects that we are looking into is also about the possibility of linking this information that people collect using the health and well-being app into your electronic health record, so that if necessary, this information can be seen by your general practitioner, or by your treating doctor, or by yourself if you have an access to your electronic health record indeed. So this working group will meet on the 6th of July at the same day as the Code of Conduct working group, and it will be the first step to discuss on how to proceed in this field. Who should take the leadership in this, and how to coordinate activities in different member states, what could be the stakeholders' input into this process. Then the third important point is that indeed, as I mentioned in the beginning, one of the tasks of the European Commission is to ensure the funding for research and also for the deployment projects. And through the Horizon 2020, we have already had several calls in which companies can apply, as well as academia, can apply for the funding or research and use these apps for the health and well-being purposes. And that is continued like this also in the work program 2016 and 17. And I would also like to highlight here one aspect that was discussed yesterday in the European Parliament about the role of health literacy in this area. Understanding of the usefulness of these apps, or what do you do with this information that you get with these apps, and how this all could be, all could influence your health behavior or disease prevention, and to increase the participatory role of citizens in managing their health as well as disease. So that is one area, and in this context I would also like to mention that also this work program is in the discussion right now, and it will only be published in the autumn. We are also considering a possibility to establish an hub together with the World Health Organization, an hub in member states who could then collect information on the use of apps from member states and share it with other member states. So these are the three main areas, as I said: Code of Conduct on Data Privacy, the Working Group on Quality and Safety, and funding for the research that we are doing right now in the area of mobile health. Thank you.
Merci. Merci beaucoup, Madame, pour cet exposé très clair, précis, dans les timings en plus. Je vais demander donc à Monsieur Chia-Feng pour avoir quelque part la vision d'un autre continent, le continent asiatique, à savoir si est-ce qu'on se pose les mêmes questions et les mêmes perspectives.
So thank you, everyone, and good afternoon. So it's my great honor to be the co-speaker with EU Commission Policy Officer. She's very kind, making me feel that I'm not the only person who cannot speak French. So really thanks for this opportunity. So I think Asia is very different from Europe, which is that European country can go to Brussels, gather together to find out harmonization, regulation, to probably can applicable to the whole European country. But in Asia, that's a very different story. Let's think about m-health, mobile health, or e-health. If you would like to really introduce an m-health device into a country, it's not only about whether you have the product. Sometimes the user itself, whether he can afford to use that, whether the product is too expensive for him, or even you got the data. Is it easy for him or her to go to the hospital to find the proper treatment? So in fact, introduction or the popularity of m-health concept in a country is never easy. It's not only about product concept itself. Sometimes the world environment also presents a different challenge to introduce our m-health product. Think about that. If you are a child in Cambodia, in Laos, probably you buy an m-health product, but if there's no hospital near to you, if there's no capable healthcare professional able to interpret, correctly use those information collected through the m-health device, the benefit of the m-health device will not be able to helpful to the older patient here. So it's very important to know the regulatory and legislation legal system in each Asian country. So first, let me draw your attention to 6,000 miles from France. Let's go to Japan. In fact, there's a breakthrough happened in Japan last year. The Japanese government tried to introduce amendment to the Personal Information Protection Act. And this act, which is a little bit similar to the new EU legislation, that basically, first of all, Japan tried to define the course data transfer standard, which means that if today there's any data transfer outside Japan, either this country should have a similar legal system, or that both parties should, through the contract, to take the necessary measure to protect those personal information. The second is that traditionally, let's say 10 years ago, if you would like to launch your M-Health and E-Health product, you probably have more 14 ministerial guidelines you need to comply with and need to follow. Because at that time in Japan, it's not too unified over guideline. So it's probably similar like you want to launch the product that European country before you commission, because there's no universal standard. And it's very weird to applicable to the one country like Japan. But from the last year, that Japanese government would like to try to establish a third party, they say personal Information Protection Committee, which this committee will perform a third party, not public sector, to enforce and to guide multiple stakeholder develop those self-governing guidelines. Through this Personal Information Protection Committee, now most of the private sector or other stakeholder group can through this committee to deal and proceed with different data. And all of the standard will be centralized, not to cross different ministry in Japan. The third exciting thing happening in Japan, probably from a manufacturer perspective, is that increase the regulatory certainty. What does it mean, increase the regulatory certainty? Because under the new act, they publish more clear procedure and guideline to especially guide a foreign company to know that first, what is a personal information definition? What is a business operator definition? This kind of a concept you cannot be found in the old law and in the old statute. Those regulatory certainty enhancement can help, especially like a European company, when you would like to find a partner in Japan, when you would like to look into the Japanese market, you have a very clear guideline to know like how you deal with those data. And will the opt-out agreement will be able to, for you without getting consent from the patient or from the customer. Besides Japan, let's go to, let's say, Australia. I think in Australia, as you probably know that since 2012, they also introduced a new Healthcare Service Act and also implement and introduce certain measures to connect different mobile health personal data provider. And Singapore, in fact, established the most sound legal and regulatory system and personal protection, which is quite follow EU style or UK style. And China, since 2010, in an improvement plan, they also have the similar, they have already highlighted the importance of e-health and m-health concept because China have a very huge territory and it's very important through e-health and m-health could connect different hospitals, patient and manufacturer. And however, the most challenging part for China is that basically the definition of personal information is very unclear. And the government are very sensitive about whether the individual citizen really has ultimate right to protect their own information. If we look into the other Southeast Asian country, those personal information protection is very varied. For example, Malaysia have a sounder system rather than Indonesia. So once you really consider the different cross data transfers, sometimes it's much easier for you to transfer the data from Japan to Europe and US, but probably it's more challenging for you to transfer the data from Japan to Indonesia, even though there's a territory nexus, because the immaturity of the system is hard for the company to find a proper rule to comply with. So thank you very much. I hope I gave a very brief picture to help you understand the challenge will be applicable to the Asian market. Thank you.
Merci beaucoup pour cette présentation. C'est vrai que l'Asie est un marché dont on parle peu, et notamment en matière juridique et réglementaire. Donc c'est pour ça qu'on a estimé qu'il était important de faire un point et une comparaison avec ce que l'on pouvait trouver en Europe. Est-ce qu'il y a des questions pour nos intervenants ?
If there is no question, I can answer.
Pas de questions sur les aspects juridiques, réglementaires, les perspectives de la Commission européenne sur les marchés asiatiques? Généralement, c'est le premier qui se lance et après, les questions suivent. Pas de questions, no questions.
You don't have a question, but I have an answer. What you said about this fact that people cannot afford the apps and the mobile health, I would say that indeed, in one way, we can look at this way, that not everybody has a mobile phone. Also, to my understanding, statistically, in some countries, we already have more mobile phones than the people. But we can also look at this in a different way, because in areas where people have difficulties of reaching a doctor, or there is no doctor even in 1,000 kilometers. If I'm thinking about African countries, or if we speak about Asia, for example, in Bangladesh, there is a very good example about use of mobile health to follow pregnant women, because who otherwise would not be reachable to doctors or medical services, or for whom doctors and medical services would not be reachable, with the help of very simple mobile health tools. Don't think that mobile health is something you can do cardiac surgery with. You can do simple things with the apps, which are for us maybe really everyday medical service, or we don't even think about this. But in some countries, that is the first step that would already help a lot of people to get a better control of their condition, to get a better control of their, in particular, chronic disease, follow the pregnancy and ensure that the birth is all around the delivery is going well. So I think that we should really see positive aspects of it. I think, for example, mobile health as a tool for reaching young people who otherwise are very difficult to reach with traditional methods of healthcare, but using SMS or some kind of modern tools of contacting them, informing them about the need of maybe a seasonal vaccination against flu, or the importance of reminding something that is sensitive in a period of summer holidays, for example. Maybe these opportunities could be used much more effectively, and we could reach to people who otherwise would not be reachable.
So thank you. So basically, you know, lawyer personality, always look at negative aspect. So if you like to comment this, basically, what I learned from the Asian is like, I believe telemedicine is really present a very helpful tool to connect an individual and to with the right doctor or with the right treatment with hospital. What we see is that, in fact, in a lot of Asian countries, the doctor, I'm not sure in Europe case, they are very strong political power stakeholder. So a lot of the time is that, for example, they say they are really concerned. If it's through those internet, they will lose their patient. So we see that in the Congress, in the Parliament, in some local Asian country, they are strong advocates to prohibit it or to delay this kind of progress because they would like to lose their patient. So let's take South Korea as an example. Basically, it's kind of the mobile health and telemedicine is only be allowed for rural area. But it cannot be universally applicable to the metropolitan area, because some hospitals will think that if the patient who live neighboring to my hospital can use this kind of a device, they probably will not necessarily move to the other hospital, let's say 200 miles away from the city, and they can get us over the service. So there's still some political hurdle happening in Asian country, and what we observe, and that will definitely retard the ultimate benefit which the patient can receive.
Merci, merci beaucoup. Toujours pas de questions? Très bien, bah écoutez, je vous propose donc d'applaudir nos deux intervenants, les remercier chaleureusement pour leur intervention. Et donc l'université d'été continue avec des ateliers, des plateaux TV et également donc la remise des trophées de la E-santé qui aura lieu en fin d'après-midi. Merci beaucoup.